Hey guys, this is Dr. Shumard from Integrative Wellness Center of San Diego, and also the author of How to Reverse Your Diabetes. You can see the book over there to my left. And today I wanted to just spend a couple of minutes on a video to really talk about, one of the most important things that I hear from our office patients is, what they're using as a metric for their diabetes. And typically when I ask that question, they look at me with a weird look on their face because pretty much the metrics they're using is blood sugar. They're using their blood sugar monitor. Their doctor is telling them that's their metric. And, based upon what their blood sugar is doing or their hemoglobin A1C. And if for those of you who are not familiar with what hemoglobin A1C is, it's the gold standard measurement of 3 months average of your blood sugars. That's what is used in the traditional medical model to evaluate how well you are regulating your blood sugars. So that specific number, 5.2 to 5.6 is ideal. That's considered non-diabetic. 5.7 to 6.3 is considered borderline or pre-diabetes. And 6.4 and above is considered diabetes. 7 and above is considered the diabetic condition is out of control. So what typically happens is when you go in and see your doctor, if it's every 3 months, every 6 months, every year, whatever it might be, for some patients right now they're not seeing their doctor for an entire year because of things that are going on. But if you're going and seeing your doctor and they're running your blood work, and your blood sugar could be high that day, maybe it's a fasting blood sugar of even 280, but your hemoglobin A1C could be a 6.5, which means that specific day you had high blood sugar, but your hemoglobin A1C is at a good managed range, and your doctors would say, everything looks fantastic. Now, if your hemoglobin A1C was above a 7, say a 7.4, and you had the elevated blood sugar, then they would be recommending additional medication. That may mean you're increasing your current dosage or they're adding on a second medication. And that's pretty much the extent of your management of your diabetes, meaning if your blood sugars go up or your hemoglobin A1C goes up, we're going to increase the dosage or add additional medications. If the blood sugars go down or the A1C is down, we're staying the course, we're not doing anything else. And that's a managed diabetic scenario or a managed healthcare, which is what traditional medicine typically does in a managed setting. So oftentimes, even through natural measures, you may hear people talking about, oh, we can help you lower your blood sugar with this supplement or this diet or whatever else. I was just having a conversation with someone online the other day, and they're talking about their program and how amazing it is based upon helping somebody lower their blood sugars. So I asked, what else are you using as a metric to see if someone is becoming non-diabetic or reversing their diabetes? And there was no response. So it's because for most scenarios, I don't care if it's a program, a supplement, a exercise routine, a weight loss program, whatever it might be, its focus is on blood sugars. And so I asked the question of what metrics are you using? And for most people dealing with diabetes, it's blood sugars. So their whole entire focus is how can we bring down the blood sugar. So they want to try to decrease the blood sugar. Well, the reality is that is not the only approach. Of course, we want to make sure that blood sugars are low because we know how damaging blood sugars can be. It can cause cellular dysfunction, cardiovascular problems, brain dysfunction, neurological dysfunction. Every single cell, tissue, and organ can be destroyed from elevated blood sugar. So of course, I'm not saying we don't want to look at that as a metric, but if it's your only thing you're looking at, you're missing the boat. And it's going to be very difficult for you to reverse your diabetes, like we've done with so many patients in our practice and how many over the years helping patients really find out what's really going on. So what I mean by that is if your focus is only looking at how can I lower my blood sugars by what's the best diet, what's the best exercise, those sort of things, well, you're only addressing the symptom. You see, the reason why you have diabetes is not because of high blood sugar. The elevated blood sugar is a symptom of your diabetes. So if you can really focus on that, if that really makes sense to you, this whole component that I'm going to talk about today, or protocols, if you will make sense. And hopefully it makes sense, because this is how we help our patients reverse their diabetes. We have a 3-step proven approach to help someone reverse their diabetes with a very high certainty, a very high success rate. We very rarely ever have patients fail in our practice. So what does that mean? That means if your blood sugars is a symptom, that must mean there must be something else going on. So if you're dealing with type 2 diabetes right now, that means at one time in your life, you were able to regulate blood sugar on your own. You were able to eat what you wanted to eat, and the next day wake up and you had normal blood sugars. Or you're able to eat what you wanted to eat, and within an hour or two, you had normal blood sugars. But over the years of doing these bad habits, bad lifestyle, whatever it might be, too much alcohol, smoking, eating poorly, or whatever it might be, eventually something started to break down in your body. Now, initially, you weren't able to notice it because your blood sugars were still fine. But as it continued to compound over the years, eventually you were found to have elevated blood sugar. So, and then now the focus in the traditional model is, how can we bring that blood sugar down? Whereas the focus, what I do in a functional medicine model or a functional health model, is to discover what it is specifically that has been broken. What systems, what organs, what tissues are not functioning optimally that is contributing to your inability to regulate your blood sugar. So I always get asked the question, well, what are some of those underlying problems? So let's talk about some of the underlying problems that could be contributing to why you have elevated blood sugar and why you have diabetes. And looking at these additional metrics will be so important, because if you just lower your blood sugars, but you're still taking medication for cholesterol, cardiovascular issues, neuropathy, have you really made a dent in what's really going on? Or are you only doing things that are helping you lower your blood sugars? See, because if you start having these other problems because you have diabetes, it's because the diabetic condition is still there. This is the reason why when we help patients reverse their diabetes, they reduce and eliminate medications across the board. Blood sugar medications, insulin, cholesterol, blood pressure, you name it, we see our patients reducing those medications because their body is healing. Their body is going back to an environment that healing can take place, and they're going to function so much better. Our patients reduce weight with little to no exercise, right? So obviously, of course, they're going to reduce the risks of future complications and an early